Good morning, media friends. Welcome to the 11 a.m. PB on the fight against the epidemic. Today, besides the Chief Executive, we have the Secretary for Food and Health as well as the Chief Executive of the TMHK. Later on, the Chief Executive and the relevant officials will give us a speech, and then we will take your questions. Because of the epidemic, please remain social distancing as well as keep your mask on during the PB. Chief Executive, please. Good morning, members of the public and media friends. Today, together with the Secretary for Food and Health as well as the Chief Executive of the TMHK, we will talk to you about how we treat COVID patients. Despite mild symptoms of the Omicron variant, in the fifth wave, we have seen a very high number of infection. Plus, we are an aging population. Many elderly people have been infected and require treatment. Now, judging by the figure announced yesterday, COVID patients in public hospitals, the number stands at 10,368. There are 81 critical patients and 138 serious patients, making for 2% of the total number of patients in hospital. According to the mainland experts, we should focus on resources, manpower, and as well as patients to offer treatment to achieve the target of reducing severe cases and death. And also, we should attach priority to offering treatments for elderly patients. That's why in the past week, we have been focusing on this direction. In terms of boosting treatments, there are several aspects. First, ramping up the treatment capacity of the TMHK. This includes increasing beds for COVID patients, increasing manpower for treating patients. Now we have the mainland support team who have joined our fight. They are standing together with the colleagues in the TMHK to protect our patients. We are happy to learn that although 20% of TMHK medical staff, accounting for some 12,700 staff members, have been infected, more than half of them have returned to their positions after recovery. Besides beds and medical manpower, of course, the medications are very important. As I have reported to you before, the two oral medications have arrived in Hong Kong, and we have a sufficient quantity to offer to patients to prevent hospitalization and severe cases. The second strategy is triage and multi-tier treatment. The first and second tier beds in hospitals will be offered to those patients in need to offer to protect to achieve focused treatment. And also we have to be more precise in terms of screening and identifying patients at home to prevent patients infecting others in the community and the households because of the lack of screening. Third, for high-risk groups, we have to offer the targeted protection. It means the 1,000 RCHEs and RCHDs in Hong Kong. Together with the Secretary for Labour and Welfare, we have reported to you how we are offering more protection to care homes, including closed-loop management, as well as elderly respite centres in sports centres. This will alleviate the burden on care homes and the hospital authority. Lastly, for elderly patients with mild symptoms and relatively good health, they will be staying at home in isolation. And we will offer home support to them. For high-risk groups, including elderly patients, we would do a due assessment so as to take them in the hospitals if needed. Now I will invite Dr. Tony Ko, the Chief Executive of the TMHK, to update you on our work. Thank you, Chief Executive, members of the public and the media friends. Now, I will update you on our progress in terms of treatment. Earlier on, the number of infections remain at a high level. As a result, there are a lot of patients requiring treatments under the HA. We have converted 50% of our beds, which are general beds, into COVID patient beds. A number of hospitals, including Queen Elizabeth Hospital, are converted into COVID-19 patient hospitals. So we are seeing the results. Like the Chief Executive said, some 10,000 patients are under treatment in our various facilities. We have also converted more than 11,000 beds to receive COVID patients. So the waiting time has improved. From the peak of a backlog of 1,800 patients on Monday, today we only have 600 patients waiting to be hospitalized. So the situation is continually improving. Some patients may still have to wait. However, for serious patients, they would be taken in as soon as possible. So the situation has generally improved. On Tuesday, we have expanded the number of our designated clinics. And also we are issuing priority tokens for elderly people and high-risk groups. That is the caring booking system. So these caring booking tokens are still available. Patients in need can still get a quota in the clinics. Like Mrs. Lam said, the 2 oral medications for treating COVID are already in use as different tiers, including designated clinics and outreaching teams. As of the 16th of March, more than 6,000 patients were prescribed with the molnupiravir of MSD, including several hundred of patients seeking medical assistance at designated clinics. Now, for Paxlovid from Pfizer, we are also prescribing the medication to patients. Some 100 to 200 patients were prescribed with Paxlovid. Now, with the help of these medications, it will surely help the situation. Now, the situation is hovering. The infection number is still hovering at a high level. And we have a high percentage of elderly people taken into hospital. Now, 2 to 3 months ago, more than 50% of the inpatients were those above 70. Now, the percentage has risen to about 70% who are about the age of 70.
Earlier, we have already adjusted our service at AWE. Earlier, if you remember, we would take in patients with mild symptoms or those who can take care of themselves. But since now mainly those who are hospitalized are elderly people, we have consolidated our resources to take care of elderly patients at the AWE. Therefore, we do see a high number of bedridden patients. We have around 200 patients there receiving treatment. So as the CE said, there is a huge need for us to increase the manpower at the Asia World Expo to take care of more elderly patients, especially for the bedridden patients and those who cannot take care of themselves. I'm very happy that in the past 2 weeks, especially yesterday, teams of medical staff from the mainland have arrived to help us take care of patients. The plan for now is to take care of patients together with our colleagues at the AWE. Upon arrival, they have started their work. Our team has been communicating to them on the process and procedures of the treatment of patients. And we have gone through the fine details with them. The team that arrived earlier have already begun their work with our colleagues, and we hope that they'll be able to familiarize with the work as soon as possible. So we now have a strong system in taking in patients, in diagnosing our patients and distributing medicine to our patients, and we're working closely together with the mainland medical staff to work together as a team. Ever since we commenced the use of the AWE, we have been adopting different cooperation and collaboration plans. We have deployed colleagues from different clusters to work at the AWE, and we also have locum from private hospitals and private clinics to work for us at the AWE. We do have our standard procedures and operations. So all the treatment plans are standardized, and we do have an updated clinical system. So any person who comes work for us at the AWE will follow the same set of standard operation procedures. I can also announce that during our discussion with the mainland medical staff, have been collaborating very well because all the medical staff are experts in their areas. They have experience in treating COVID patients. They're also staff from infectious disease departments. They have also had experience in fighting the pandemic in different areas. Some of them have been stationed in Wuhan and some in other places in China. Therefore, they are very experienced in the treating of COVID patients. We also noticed that in our treatment that the mainland actually adopts a similar approach in the treatment of patients. We all draw reference from similar international guidelines, and those act as a blueprint for us. So we all look at the same oxygen level and the count of breaths, etc. And for laboratory examinations, we also adopt the same standards as well. Therefore, it's very easy for us to cooperate with each other. We noticed that some people asked about the jargon used, and that sometimes the terms may be used in Chinese, but then we basically understand because we communicate with our patients in Chinese. We would say the English term and also use the Chinese term, although they may not be exact translations. Actually, those who they understand in those clinical terms, especially when we are from the same specialty, then it's even easier to understand. Those who work in the AWE adopts the same CMS. We would use the standard template to input data in their tablets, and we have actually now launched a Chinese version, so it's a standard template with standard operations. And actually, it's very easy for us to go back and forth in Chinese and English because they also understand all the clinical terms used. The mainland medical staff have already gone into the red zone to help us take care of patients at the AWE. And we look forward to the 200 plus arrivals yesterday to also start their work as soon as possible. They are actually our honorary staff. We have this sort of arrangement for those who come from private institutions and also from universities. So we've always had this arrangement. We really hope to enhance our manpower at the AWE to ensure that the quality of treatment can be ensured. We are mainly taking care of elderly patients at the AWE, and they do need clinical treatment. Therefore, with an increase in manpower, that would be of huge help. With the support of the medical staff, we hope to treat newly infected patients as soon as possible because we see many people from the RCHEs that they are dehydrated or they are not very up to beat in spirits, so we do try to keep them hydrated. And in the geriatric department, we want to ensure that there'll be both high-tech and high-touch. Therefore, with the support of the mainland medical staff in technology, in knowledge, will be able to control the pandemic as soon as possible. I really like to express my gratitude to their support because this is a huge wave of the pandemic, but with their support, we'll be able to better support and treat our elderly patients. Thank you. It's now Q&A. Those who would like to ask questions, please raise your hand and please identify your media organization and speak through the mic. As there are a large number of reporters, in order to provide more opportunities, each reporter or journalist can only ask 2 questions and there will be no follow-up questions. The lady in the middle. Hello from Now TV. First of all, I'd like to ask about the compulsory universal testing. Well, although the government has already refuted the rumors, people are very concerned. So would it still be in 3 rounds starting from March 26th? And would there also be a sort of lockdown? Have you shelved this testing scheme, or is it actually still in preparation? Professor Yuen Kwok Yong said around with 95% vaccination rate, the social distancing measures can be relaxed and that flights can resume as soon as possible. So what is your view on that? And for mild symptom patients, do they have to be sent to isolation quarantines, or would you adhere to Professor Yun's comment to home isolation at home? And when can you relax measures? Thank you. Thank you.
Now, on the 22nd of February, I said, well, when I announced the measures in the coming days concerning universal community testing, like you correctly mentioned, yesterday we issued a press release to clarify that the online rumors are not accurate. Those are not the those are not the details of our plan. We have never mentioned the date 26th of March, but I can tell you that we have been deepening the plan since February. We are calculating the manpower needed. We even paid site visits to identify suitable places to be converted into community testing centers, including school premises. It is a large-scale testing operation. We need to be prepared. If we miss the opportunity, then we will never be able to kickstart the scheme. That's why we are engaging in all the preparation. I understand that the public would like to know as soon as possible whether it would be conducted and when and how. So in the coming few days, I will once again update you on the measures announced on the 22nd of February. The epidemic has developed quite rapidly in the past month. Every day we have some 10,000 cases. Now, including the RAT positive cases, at the peak on the 3rd of March, we even had some 70,000 cases. So we need to continually adjust our measures according to the epidemic. In order to achieve the best results, we have to continually assess the situation. There is no decision yet. However, I will update you on the latest progress as soon as possible, not just on the UCT, but also on other measures announced previously. Given the developments of the epidemic in the past month, I will give you an update on those measures as well. Your second question is on the statements made by the experts. When the vaccination rate has reached 95%, then we can do such and such. Of course, we want to achieve the 95% vaccination rate. However, if you are saying that when we reach a 95% vaccination rate, then we can relax social distancing measures and immigration control, then it may cause even more panic. With the efforts we made in the past year, eligible population above the age of 11, the vaccination rate has just exceeded 90%. To be exact, 91.3%. In the past few days, the number of people getting the first jab has been on the decline. So that is the reality. The last stretch of the race is the hardest. Those would be people who are staunchly opposed to the idea of getting vaccinated. So yesterday there were 8,000 people getting vaccinated with the first dose. In order to get those staunchly opposed to getting vaccinated so that we can get 95% vaccination rate, that would be very difficult. So if we are saying that we can only relax the measures when we reach 95%, then it would be putting constraints on us. So of course, we want to achieve even 99% of vaccination rate. Now, the priority now is to boost the percentage of second dose from 81% to at least 90%. For elderly people and the young, we want to raise the vaccination rate to 90%. For children aged between 3 and 11, as of yesterday, the first dose percentage is just 55.5%. So this is still a long way to go. For those above the age of 70, the first dose rate is 70%. So judging by these figures, we should continue working. If we set an unrealistic target and we are not able to achieve that, then we would be criticized by the public that people are still subject to harsh immigration control measures and social distancing measures, and people cannot return to Hong Kong. But this doesn't affect our top priority, that is to exhaust our means to boost the vaccination rate. Now, under the framework of multi-tiered treatments, there are 5 tiers. You can find all these information on our thematic websites at TMHK or the CHP's website. The 5 tiers. The first and second tiers involve hospitalization and inpatient treatment. The third tier is for stabilized patients to be transferred to community treatment facilities, including the AWE and the North Lantau Hospital's Hong Kong Infection Control Center. Earlier on, we didn't have enough manpower. Now, thanks to the support from the mainland team, we believe that the third tier will fulfill its function better. Now, the fourth tier is a respite center with health monitoring. The social welfare department has set up a respite center for elderly patients recovered or in convalescence. The fifth tier is for non-high-risk groups and patients with mild symptoms or even no symptoms. They are under home isolation. That's why we are saying that we have to offer more support to people in home isolation. Without the multi-tier framework, it will be very difficult for us to deal with the tens of thousands of new cases each day. Next question. The reporter in white. Hi, I'm from News. 2 questions. Recently, in the AWE, 4 elderly patients were sent to the hospital and 3 passed away subsequently. Now, in terms of reducing severe cases and death cases, what has been done to improve the situation as the AWE? Now, with the medical teams from the mainland, what have they been doing and how did it help? Now, according to some reports, there are lots of spaces in the AWE. Now, what about the occupancy rates of different facilities? Is it because of the lack of manpower or other reasons? Now, about the second question. The AWE Community Treatment Center. The total number of beds is 1,450. For a long period of time, the occupancy rate was indeed low. And for phase 3 or hall 3, 450 beds, they are still in reserve. The reason is simple. We lack the medical manpower and carers. Because of that, the HA is under huge pressure. I gave you a figure just now. Healthcare workers under the HA during the 5th wave, there were some 15,667 healthcare workers infected, accounting for 20% of the total manpower of the HA. Because of that, some facilities occupancy rates remain low. Because of that, I made a request to the Central People's Government to deploy medical delegations to help us so that we can better utilize the facilities to provide treatments to COVID patients, especially the elderly.
Yesterday, we welcomed the arrival of 300 medical staff from 20-odd hospitals in Guangdong. With this team to support us, we'll be able to fully optimize the use of our facilities. Well, yesterday, a few elderly patients who stayed at the AWE but who were not COVID patients, they were actually patients in isolation arranged by the SWD. A few of them, unfortunately, passed away. We feel pain for their families. Actually, the elderly patients are very old. They are respectively 89 years old, 92 years old, and 98 years old. They are chronically ill and have not been vaccinated. Well, although they were staying under the SWD's care, they had support from the community center. and medical support was provided for them. Let me defer to Dr. Ko on the medical resources provided at the AWE. Well, let me reply in Cantonese. Well, in the halls manned by the SWD, we also send in medical staff to support the patients. We have outreach medical staff and nurses to support them. The unfortunate deaths were of elderly people, and we review to see whether we could improve our services. It might be a bit difficult to identify their illnesses because they were not able to tell us how they felt. We would ask our colleagues to review and see whether we could improve. We hope to do a bit more in terms of providing medical support. As the CE said, we have the medical facilities under the HA just next door. So we do have mainland staff supporting our colleagues in that hall, and hopefully we'll be able to also provide some sort of support to the isolation facilities. I'm sure that with better collaboration, we'll be able to enhance our work. Next question. The gentleman in the back. I'm from Ming Pao. We've heard that after the elderly has agreed to vaccination, that person has to wait for half a year before the first dose, and then unfortunately that person passed away. Well, the CE has already promoted vaccination for a very long period of time. So how did you allow this to happen? So who should take up the responsibility, you or actually the staff at the RCHEs? You said you're going to announce procedures or measures in the upcoming days. So what kind of measures would you actually be announcing? Do you have a clear timeline for us or for members of the public to know when we'll be able to see a relaxing in social distancing measures? Thank you. I can only briefly address one of your questions. I'll ask Professor Chen to elaborate. The government has set up an expert committee. Every time there are changes to the vaccination scheme, must go through the expert committee. I will ask Professor Chen to tell you more about that. Well, we really have to rely on the views of the experts. There are clinical experts, medical experts. Therefore, in the past 2 years, we have been respectfully listening to the views of the experts. While for social distancing measures, we would, of course, assess the situation after hearing their views. But I cannot, or I do not have the knowledge to say when a vaccination should be made. Well, I suggest you refer to the detailed announcement made on February 22nd. As I said, during that day, on that day, the next 2 or 3 months are crucial. And I made that announcement based on the statistics and figures I got during that time. The numbers at that time did not seem to go down, and therefore I adopted the measure of asking schools to take an early summer vacation and then to extend the flight ban for particular countries. With the surge in cases, I believe that we should try to find a midpoint within these 2 months around March to announce to the public our measures, to follow up on our current measures or to make changes to the existing measures. I hope that we'll be able to see how we go forward. However, there is still something uncertain. The number of positive cases, have they peaked or plateaued, or are we going to see a downward trend soon, or would with more social gatherings the cases would rise? We really cannot foresee how it's going to pan out. We really cannot tell the future. We can only adapt measures to the best we could. If there could be figures to help us work out the timeline, of course that would be for the best. Professor Chen can tell you more about the details of vaccination. Thank you, CE. A year ago, the government has already started providing 2 vaccines, Sinovac and BioNTech, to the members of the public. At the initial stage, we already placed the elderly as priority because we believe that the elderly are of high risk and should be vaccinated as soon as possible. The elderly, however, was not very clear about the scheme and had a lukewarm response to the vaccination scheme. We, however, did not give up. The SWD and the Department of Health have been trying their best to increase the vaccination rate in RCHGs. The RCHGs were not clear about the scheme, and some family members did not agree to the vaccination. With the government asking experts to give more information, this situation has been improved.
On the intervals between jabs for different vaccines, like the Chief Executive said, under the CHP, we have the Joint Scientific Committee. The experts have been giving recommendations on the intervals between the first and second and the second and third jabs for different vaccines. The experts have also struck a balance between the benefits and the risk based on the epidemic situation. Since the beginning of the vaccination program for high-risk groups, especially elderly people and immunocompromised people, including children, the Joint Scientific Committee has given recommendations on the intervals between the jabs. Of course, for different vaccines, the pharmaceutical companies have issued, have given different advice. For BioNTech and Sinovac, the interval for one is 21 days, and the other is 28 days. For the interval between the second and the third jabs, originally it was 6 months. However, judging by the risk and benefits, and in face of the pandemic situation, it has been shortened to 3 months. Now, for recovered patients, The Joint Scientific Committee has also given recommendation on the intervals between jabs. So for the case you mentioned, it depends on the specific circumstances. Now, every time when the Joint Scientific Committee is issuing a new guidelines or recommendations, updates would be uploaded onto the thematic websites. Now, the gentleman in the front.
Danny Lee from Bloomberg News. I'm just wondering, the number of imported cases is minuscule compared with the caseload in Hong Kong at the moment. Why do incoming travellers still have to quarantine in a hotel for 14 days when infected people in the city can stay at home for 7 days? Would you be considering cutting the hotel quarantine for travellers to 7 days? Also, what conditions would you need to see in order to revive contact tracing, and when do you expect that to happen? For example, is there a threshold for daily case numbers that need to be reached in order to do that? Or are we just waiting for the outbreak to naturally abate, in which case would feel more like living with the virus? And then finally, yesterday you said one of your 3 considerations when setting up a public health strategy was people's acceptance and tolerance to the measures. How do you measure people's acceptance and tolerance at the moment, and how close are we to the limits, perhaps, of people's tolerance? Thank you.
Let me start by responding to the last bit of your question. Well, since the beginning of fighting the epidemic in January 2020, upon the advice of my experts, particularly Professor Carrie Lam, we have accepted that it is not an exact science to devise our public health measures. I recall that I actually used a cartoon to show that it is a 3-way tug of war. One is, of course, very important public health considerations, because there's a job of the government to protect the safety and the life of the people. The second is the economy, because there used to be a saying that what's the point of keeping me alive if my livelihood has been cut to a bare minimum. The third is the people's acceptance and tolerance, because every public health measure requires people's cooperation, like vaccination, like coming forward for a test, like not going to the beaches, and so on. So, I'm afraid that balancing these 3 factors, again, is not an exact science. I can't go out to do a research or then crunch some numbers and say that the time has come for an optimum balance to be struck. So it is a very difficult job. I hope you have some sympathy for myself and the SAR government. It's an extremely difficult job, especially when we are now in this unprecedented 5th wave, with unprecedented number of confirmed cases and unprecedented and very saddening number of deaths. But I think the time has come, and that's why I promised that instead of waiting for the 20th of April, which was the original end period of the range of measures I announced on the 22nd of February, on the basis that the coming 2 months would be critical, I think the time has come for the government to have a midterm review of all those measures announced on the 22nd of February, ranging from border controls, such as flight bans, to quarantine period for arrivals, to whether we are going to do this compulsory universal test, and the resumption of face-to-face learning in schools, and social distancing measures. So just give me a little bit of time. When the 1-month period comes, that is around the 20th or 21st of March, I will give a comprehensive update on the situation. Because the reason why I think the time has come is not because of the number of cases have come down significantly. They are actually now at the high-level plateau in public health terms. But I have a very strong feeling that people's tolerance are fading. I have a very good feel that some of our financial institutions are losing patience about this sort of isolated status of Hong Kong. And Hong Kong is an international financial center. And nobody attaches as much importance as myself to Hong Kong's international status under one country, two systems. So with those feedback given to me from various sectors and people, I will boldly take this step to update you on the midterm about the future direction of some of those measures. But I should just mention that the 7-day at the moment works like this. The period for the quarantine order and the isolation order is still 14 days. But what the Center for Health Protection has put in, which I think is a sensible move, is if you do a RAT, a rapid antigen test, on day 6 and day 7, if it turns out to be negative, then you will be regarded as discharged and you can resume your normal living. So in terms of consistency, there is a very strong basis for us to apply more or less the same rule to arrivals. But we just need a bit more time because it's not a simple situation of, since Hong Kong has so many cases, why should you ban people from other places which are less serious than Hong Kong from coming in? That is only one of the factors when we consider border controls. The other factor is the hospital authority. For example, if you have a flight coming in with 20, 30, 40 infected cases upon arrival, these people will have to be taken care of by Dr. Goh. So I have to take full account of the pressure on my HA colleagues in opening up the border again. But let me assure you that this is very much on my mind. I'm working it day and night to find the optimal solution for Hong Kong.
好，跟住另外一位記者兩條問題，前排中間嗰
Next question, please, the lady in the front. Hi, I'm from Cable News. Now, Mrs. Lam, is there an indicator for relaxing social distancing measures? Will you consider it or consider resumption of flights before we reach a 90% vaccination rate? Will you make an announcement in the coming few days? And also, what about relaxing restriction measures for scheduled premises? Now, there are restaurants not opened, and a major fitness center chain has closed up. So how can you expect the restaurants to keep surviving if they cannot open? Now, there are Weibo netizens criticizing our epidemic situation and our way of handling it. It seems they think that we are dragging their feet. So do you think that this is distancing the relationship between Hong Kong and the mainland?
Let me first take the second question. Well, every day we see many comments and rumors on the social media platform. My best solution is not to read it, not to listen to it, and not to believe in it. When I have replied earlier that in our anti-epidemic work, we are not just looking at one indicator or one factor. We must look at it in consolidation and then make firm decisions based on those. But we won't know whether it's 100% accurate until afterwards. Well, I can say I relax social distancing measures today, but then in a few days when cases surge again, then you would say that I made the wrong decision. After 2 years of living with the pandemic, based on views given by the experts, we know what sort of intervention is more effective than others, and therefore we have adopted measures based on those. On February 22nd, we announced a series of measures based on the severe situation at that time, but of course it aggravated after that day. We stopped face-to-face teaching and encouraged people to work from home and also extended the flight ban. Well, originally, I set the deadline to be April 20th because we knew that we wouldn't be able to control the epidemic within 2 months. But I thought at that time that we could take a look at how the situation pans out after a month. and to review our capacity and also our measures to see whether we could set a better balance. And first, of course, we need to take a look at the public health situation, the vaccination rate, our treatment capacity, increase in isolation facilities. And then on the other hand, what you mentioned, the financial situation. It is a bit worrying at this moment, some due to the epidemic and some due to external factors. We also must consider what kind of financial impact it would bring. And thirdly, it also depends on whether the public will continue to comply with the measures. Because if the public do not cooperate, then it wouldn't work. So we are working on it and hope that in a few days we'll be able to come up with a detailed announcement. Last question for the day. The lady in green. Orange News. Well, the government said that there would be an opening of more vaccination centers to boost up the vaccination rate. So when do you think that it will be arrived the 90% vaccination rate? You just now said that that we have seen a reduction in the numbers of vaccinations in recent days. Do you know why that is the case? And on March, you said that by March 18th there will be an outreach team going to the RCHEs to vaccinate the elderly. So how is this doing now? Well, let me try to reply to your questions and see if Professor Chen can supplement because I do not have too many details on that. On the second dose of vaccination for eligible 11 years or older, it's 81%. Past experience has shown us that with the first dose, after the first dose, it will be a short interval before you take the second dose. There was a time when people did not want to go for the first vaccine. But you know that there is a short interval between the first dose and the second dose. We believe that the percentage of 81 will go up gradually because this only shows the number for the first dose. So in around 21 days, those who have received the first dose will come take their second dose. So we do not need to take any measures here because we'll be able to reach the 90% very soon. But then we do have urgency for the third dose because for some of the elderly, the interval between the second shot and the third shot has been reduced. Now you hear people talking about the fourth jab overseas. So it seems that this is actually a continuing process. We are placing priority for the elderly and the young at this moment. We have set up, starting from tomorrow is March 18th, we'll be able to reach a target. 1,000 odd RCHEs would see outreach teams reaching out and vaccinating those who are eligible. But as a Secretary for Labor and Welfare said, some family members have refused to jab their elderly family members. But we encourage them to be vaccinated as soon as possible. And we are also reaching out to elderly who live alone. The elderly can actually go and be vaccinated on the day at the centers. For young children, we have already reached a first jab of 55.5%, and there are around 230,000 3 to 11 years old who have not yet been vaccinated. We are going to try our best to vax them as soon as possible. Professor Chen. The CE has basically laid out the plans for the vaccination scheme. All along, or especially since the fifth wave, we know that people's desire to be vaccinated has been boosted, and we are trying to increase the number of vaccination centers. Other than the existing centers, we are trying to convenient members of the public with mobile vaccination stations. And vaccination days organized together with district councillors. And recently, we have also set up mobile vaccination centers at public transport interchange, like the Chengyi MTR station. So people who really want to get vaccinated can go at any time. The HA's general outpatient clinics and other hospitals have also set up vaccination centers. And also at the district health centers in Shamshui-Po and Kwai Ching, they have already become a vaccination center. And every day they would only be giving out vaccinations. And we also organize vaccination days at some of the DHC Express. We really want to convenient members of the public so they can get vaccinated as soon as possible. You asked why the number of vaccination rate has gone down. Well, that's because many people have already taken their first jab. And it may be because some of them are still unwilling. I would like to especially appeal to those who are not yet vaccinated to get a jab as soon as possible. It's not only for the protection for yourself, it's also to protect those around you. Being unvaccinated will compromise other people's health and also decrease the efficacy of us fighting the pandemic. Well,
now, today's afternoon, we will announce the latest unemployment rates between the 3 months between November last year and February this year. Tomorrow, together with the Secretary for Labour and Welfare, we will talk to you about the employment situation under the epidemic, as well as our support for labourers. Thank you. That's the end of the media briefing today. Thank you.